Right, we're ready for the final session, and we've had a wonderful time over the last few days. We've learned a lot about NTDs and the curious habits of Australian possums, but now we're going to try and consolidate things. So I'm going to hand over to Kingsley, who'll give us the orders. I'm chairing this, and although I'm English and very polite, I'm really a Scot, so I'm quite rude. So I will be very, very tight on you, okay? Kingsley, do you want to?
Okay. Hello, all. Okay. Good afternoon, friends. We're almost there. It's been a marathon, but this weekend, well, those of you traveling, but some of us will have to take some rest. I have a few slides first to kick off the closing part of this 5-day meeting. Just to recap a few things. Steph, yes, please. So, again, you all have copies of this document. We have additional copies here, so if you need more, just send us an email and we will send some to you. Next slide, please. We have also shown you all the available documents that we have in the WHO NTD, so feel free to reach out, and the link is there for you to access them. Next slide, please. And then let me go back to the objectives that we started on Monday. First, we have heard the first point, progress, challenges, implementation, country level. We've also heard a bit about research and advances in that direction. Implementation of the framework linked to the first bullet and how some of the challenges. Now the framework is out. We'll see how to move forward, taking into account the progress and the challenges. And what I said on Monday, the most important part is the networking. Next slide, please. Let me remind all, although we didn't talk about guinea worm in the skin NTDs, that this is a disease, one of the two diseases in the NTD department targeted for eradication. I think after so many years, there are only a few countries with a few diseases, so those of us working in those countries, let us keep guinea worm in our surveillance system. Next slide, please. And then we've heard about yours many times during this meeting. It's also the second disease targeted for eradication. I encourage all those doing skin screening, skin and surveys, please look out for yours. If you are in doubt, just test with the rapid syphilis test, the test that is used for many other syphilis and maternal health conditions. Next slide, please. So these are the topics we have covered over the last 5 days. I will not go into details. Next slide, please. And when we look at cases where skin NTD, at least one of those listed down there, we don't have data for all of them. And I will also encourage countries to report data to WHO. I saw, for example, a case of mycetoma, a picture of mycetoma. I don't know whether it's from Ghana or Cote d'Ivoire. They wanted Professor Fahal to confirm. But in your course of your work, if you find any of these cases, please let us know so that we can update our data. Next slide, please. So these are the regional distribution of different diseases. Guinea worm is not there, but guinea worm is left in Africa, Afro region, and also in Emerald. I think these are the two regions that still have some work to be done on guinea worm. Next slide, please. So again, on Monday I said who is here and who is online. Now we know who is here, but we have many people who are online, and we will make sure that they also receive the links to the presentations, abstracts, and all the information that came from this meeting. Next slide, please. In terms of Again, where people have come from, we will update this map. This was before the meeting. After the meeting, together with the Zoom registration and in-person registration, we will see how many people attended and from where. Next slide, please. And then intersections for integration, again, field work, the lab, research, community awareness, community mobilization, community engagement. But underpinning all is the issue of poverty. Poverty and access to health services. I think this is what will be one of the challenges. I know we cannot address issues of development, but we can at least deal with the health aspect of it. So let us not give up. Next one. And then, as I said on Monday, we will look again, but most people here or attending the meeting had interest in leprosy, which is very good because we have leprosy everywhere. Leprosy elimination, interruption of transmission is key. But the network of leprosy, the vast network, can also drive the integrated skin NTDs along. So I will encourage the leprosy community here. You will not lose anything by bundling other skin diseases along. Next one. We also saw that many people here, I think this slide needs to be adjusted, but the red line is for research. So those who registered in terms of cross-cutting areas, where their interests, most of them were interested in research, and I'm sure that is a reflection of what we have seen. Next slide, please. So we were very grateful. If you do not see your face here, it means you cannot go back home. You have to wait to get another picture with the Director General. But it must be a privilege to have a picture with the DG. We will share the link, which has all these photos, so that you can keep them for your own records. Okay, next slide. And thank you very much all.
Thank you. Thank you very much, Kingsley. Now, what we've organized is to have 5-minute presentations from different groups. So these are going to be the regional directors going to go first, and then we're going to have the chairs of the sessions. I realize 5 minutes is a very short time, but there will be plenty of opportunity, I think, to analyze the data that's coming in, and we'll come up with some ideas of how to continue the momentum. So can I start by inviting the representative from Wipro to kick off with the first presentation?
Thank you very much, Mr. Chair. So we have 3 points to bring to the table here. The first one and the second one is a recommendation. So ending the neglect is really important for ending NTDs. And that neglect has to basically start from within, from WHO. And can we go to the next slide, please? Yes. So for that, what we recommend is that the Director General communicate with the regional offices and the country offices to highlight the importance of NTDs, and also including NTDs in the country cooperation strategies. Next slide, please. The second key thing is funds. If you go to the countries and you ask one question, and that question would be, what is the #1 priority for you to fight NTDs in your country? They would say funding. So we hear a lot about that. For that, I think not only at the global level, but at the regional level, there are a lot of opportunities. For example, in In Wipro, we have Asian Development Bank, which is interested, and they have more interest in the region. So tapping global opportunity is one thing, but also regional and local, national opportunities should be there. Next slide, please. And then the potential for disease elimination in our region is there. The region has been successful in eliminating lymphatic filariasis from 11 of the 22 endemic countries. Similar is the case with trachoma. We have, huge success. We have, in Vanuatu is a very successful example. It's a small country, but they have eliminated 2 diseases, and more eliminations hopefully are in the pipeline. So the chances of success in the region are high. However, the 2 conditions, as I mentioned before, is the commitment and funding, and also, of course, integration. With these 3 elements, we can achieve success. Thank you.
Thank you very much. That's set down a challenge that other regions will need to follow. So thank you very much, sir. Can I now call on the representative of Southeast Asia to present?
Good afternoon, Chair, and thank you to all colleagues. Southeast Asia region has 11 member states. So out of that, 6 member states had already eliminated at least 1 NTD up to now. So it is more than 50% in that direction. And also, currently, the Bangladesh is now submitting the dossier to the regional office for about the elimination of the lymphatic filariasis as a public problem. Also, it is in preparation of the dossier for the visceral leishmaniasis. So it's a potential candidate for very near future. For this meeting, so I learned a lot as a region, and I really thank you very much to all presenters for their contribution to us. The first point, confirmed point, I learned is that, given the limited resources, the skin NTD must be integrated whenever possible. This is very important. The second point is that this integration should be in accordance with the context and ownership at the country level. These are also very important for me. So that's why a way forward for the Southeast Asia countries is, first one is in consultation with the country focal points. The region is currently in the process of developing the regional toolkit, so we developed the regional toolkits for the skin antigens within this year. And also we'll invite the interested countries of our region for piloting it. And then also support the orientation on the integrated skin NTD interventions to the primary healthcare workers, because they are frontline community-based health workers, so very important for us. Also, there's a lot of the evidence shown here in the today conference and meeting. And linkage with the specialists and dermatologists, so that is another important dimension. And also, our region will support the SOP to implement the skin camps approach. This skin camp approach presented by the different presenters are very exciting to us, and this is the good approach have to follow, and targeted approach depends on the country and endemicity. Also, we will support the photo database and low-cost, user-friendly AI technology. So nowadays, the AI will be more and more pronounced in our life for that kind of control, elimination, and even in the post-elimination surveillance. And then the conduct quarterly meeting on the piloting countries to share and learn experiences, challenges, and good practices during the pilot period. So also we collect all experiences to finalize the regional toolkits before the end of 2024, and then sharing and dissemination of the regional toolkits and support the integrated skin NTD intervention approach at the country level, because our primary intention is to achieve the impact or greater impact at the country level. So we'll be deployed that at the country level in 2025. This is our lesson learned and way forward for our region. Thank you very much for your kind attention.
Thank you very much, Dr. Lin. I really like your method of trying to keep the momentum going, so thank you. Thank you for that. The next is the representative from PAHO. Senor.
Yes, thank you very much. Just 3 points that we want to highlight here. The first one is that we are committed as a region to implement, adapting it to our region, the strategic framework for the integrated control and management of the skin NTDs. This is within the context of PAHO's Regional Disease Elimination Initiative. This is an initiative that was approved in 2019 and by the PAHO's Directing Council, by which the member states committed themselves to intensify their efforts to eliminate about 30 communicable diseases, including some of the neglected tropical diseases and risk factors by 2030. The second one is that, the second point is that we need, as was mentioned here in this meeting, we need to assess the burden and risk factors of certain skin NTDs of which we don't have much information, particularly the ectoparasitic diseases and the mycotic diseases. Because based on that information, we will be able to develop a strategy for the public health surveillance, control, and eventually, if possible, elimination as a public health problem of these diseases that could be implemented at both the regional and the country level. And the third point is that we are still worried about the fact that COVID-19 really had a great impact, as, for example, occurred in the case of leprosy, not only in the Americas, but worldwide, where the number of cases dropped by 35% in 2020 as compared to 2019. And there was only in the Americas region a very marginal increase in 2021. So we have a backlog of patients there with leprosy and maybe with other skin entities that have not been diagnosed or treated and that are at greater risk of developing complications and also are transmitting the disease still. So that worries us, and we should work together with the countries to design some strategies to catch up with that backlog and let's say, have those cases, make them visible, and get to detect those cases and treatment, then treat them and do all the healthcare measures and public health measures that must be done in those cases. So those are the 3 points that we wanted to highlight. Thanks very much.
Dr. Nichols, thank you very much. They're very important. I'm very glad you mentioned that last one because it's a worldwide problem and very important to take on board. Thank you. Can I now ask the representative from the Global Leprosy Programme to present?
Thank you, Chairperson. And it is indeed heartening to note the interest in leprosy in this room. Thank you so much for this opportunity. This is an opportune moment, a momentous moment for all, where the skin NTD integrated programs have demonstrated the opportunities for augmented case detection, for strengthened surveillance, for reduction of stigma, and renewed partnerships as we all come together in this forum. It is thus an opportune time for us to call upon 3 important things: country commitment and ownership, exemplified through renewed focus, policy recommendations, and increased domestic funding for diseases targeted for elimination; strengthened research, as there are still gaps which exist in knowledge, as well as the availability of tools for disease conditions which are targeted for elimination. And finally, advocacy with the national programs to strengthen preventive initiatives to accelerate progress towards reaching the goals of NTD Roadmap 2030, because there are certain tools which are already available with us, and we need to make the most use of it. Thank you, Chairperson.
Thank you very much, Dr. Lal. And you'll notice that your comment about research is also echoed by the audience, so very important. Thank you. Right, our next speaker, could I ask the representative of EMRO to take the floor?
Well, I have been asked by EMRO to present this on their behalf. So whatever I'm reading, any mistakes, disagreement, dispute, please, don't ask me. Yeah, I'm only. So in EMRO, I think, as I mentioned, guinea worm is targeted for eradication. I believe the only country left is Sudan. So there are already efforts underway to help with the documentation and the preparations of the necessary dossier to be submitted to WHO for review and possible certification, hopefully in this year. Yours was reported in the old days, meaning the 1950s, from Somalia. I think there are efforts now through the integrated activities to also explore whether there's still yours in Somalia. And there are all plans of the region to eliminate at least one NTD from the member state by 2030. The issue of financial resources, I think this we have heard from everyone, it remains the central problem to ensure that WHO technical guidance at country level can be provided by the staff and to support also critical interventions. One of the areas of concern to the EMRO region is cutaneous leishmaniasis and access to the treatment, which is quite a challenge. Then advocacy to facilitate global supply of diagnostics and medicines for case management, as I mentioned, mycetoma as well, and the development of point-of-care tests and new medicines to address these diseases. So these are the key takeaway messages coming from Cairo. Thank you very much.
Kingsley, thank you very much, and I won't put you on the spot by asking you searching questions. Thank you. And our last presenter in this session is from AFRO.
Thank you very much. So for the Africa region, which is disproportionately affected by the burden of NTDs, almost acquiring half of the global burden, and with poverty, a problem, and lack of access, and with successes coming from countries which we have 9 countries which so far eliminated NTDs, and notably to take example of Togo, which have eliminated 4 diseases. So we have 3 messages as have been outlined. The first one is to improve country ownership, because this is the basis for implementation of NTD program, to have a better coordinated activity for NTD implementation, and also integrate under the primary healthcare unit for sustainability of the program, and also whatever level of funding from national government. Again, that is also very critical, as have been mentioned by the DG this morning. And the second is to improve capacity of the national health system in terms of diagnosis, case management, and surveillance, but also doing implementation research to have success in the field. And also in some areas, still we don't know the burden of some of the diseases, especially the newly added diseases, including the skin and NTDs. So we need also support in terms of doing the burden of the diseases in some of the countries. And the last one is resource mobilization, because we need a lot of resource for NTDs, and also to address all NTDs, not because some of the NTDs are extremely neglected. So we need, funding for for all of the NTDs that we have in the region. So we need a lot of advocacy for more funding, and also to look for special funding mechanism, as have been mentioned this morning. Flexible funding, and also resource from other donors, including linking with the global fund applications that will help sustaining the program in the region. Thank you very much.
Dr. Bashar, thank you very much for that report. And I think all of us who've been in this meeting have been impressed by the leadership that the African region has actually given to the Skin NTD program. So thank you. Right, well now, we now turn to the session chairs who are going to present summaries. And just to remind them, we've heard from the regional directors who are all very well behaved and kept close to time. We're now going over to our academic and clinical colleagues. I hope they will do the same. So, Claire, can I call on you?
Thank you. So I was chair of the opening session and introductory presentations, and thank Bernadette Agbavor and Abate Mulati-Beshe for their fantastic rapporteuring, which has made preparing this report much easier. So we noted the increased interest and participation of dermatology specialists. I think that was one of the things that was brought out since the 2009 meeting. Dr. Fahl assured us that the roadmap targets are deliverable, the investment is achievable, and ending NTDs is within our reach. And I think that was a really good highlight and headline to get started with. Dr. Dagny encouraged us to learn from each other's experience, enabling us to formulate evaluation and action planning. And Professor Hay noted that 1/3 of the world's population, a really important piece of information, is affected by skin disease at any one time. And the data presented here suggests that it's probably higher amongst our endemic communities, with at least 2 studies presented here showing a background of 50% of skin disease. And he also highlighted that the skin disease approaches provides a critical entry point for strategies to address the roadmap targets. Professor Yotsu explained the Skin NTD framework, showing it's a practical guide for integrated interventions, including One Health approaches, to achieve the goal of reduction in morbidity, disability, and psychosocial impacts of skin NTDs. Vivek Lal reminded us of the 4 pillars of the WHO leprosy eradication strategy, which echo the approach that other NTDs will take and follow, and it's all very integrated. And Pamela Mbabazi wondered if NTDs should become notifiable, which might make us help remedy the data gaps. She reminded us that data collection tools exist for most of the NTDs, but the need for strengthening the routine health information systems was required in order to ensure we have really accurate data. Deborah Friedman covered the Australian Buruli ulcer situation, noting a significant increase in cases, and stressed the importance that capacity building in all aspects, from early case detection through diagnostics and management pathways, were required to effectively sort this out. And although we didn't hear from Herman Feidmar, we did hear during the rest of the meeting that Tungiasis had a high morbidity, especially associated with heavy infestation. Dr. Huang encouraged us to address evaluating impact and challenged us to produce robust data to do this. And finally, Professor Esther Freeman introduced us to GLODERM, the International Alliance for Global Health Dermatology, a growing community of dermatology specialists to serve in this space. And I think that sort of summarizes our session.
Thank you, Claire. That was very, very comprehensive and very useful for our record. Could I now invite our next chair, who's Dr. Rie Yotsu, who's going to present the conclusions from her session.
Thank you. So I sessioned to the integration at country level, and I would like to also thank the rapporteurs, Dr. Gislen Sopo and Dr. Zolin, for preparing a very comprehensive report to make this slide available you are seeing now. And we had a very interesting session with country experiences from multiple countries, from Africa, Pacific Islands, and South America. I did not obey Kingsley's order to make simple slides, I'm sorry. But I put together this slide, kind of trying to map out what we heard and what we did not hear, and to help us understand the progress and the gaps that we had. The numbers are showing the order listed as in the Skin NTD framework, And just a reminder that we had the 20 cross-cutting areas identified in the framework. Integration was happening for both MDA-targeted and non-MDA-targeted skin entities in countries. Much integration were happening around MDA, social mobilization, active case detection, and training. And to do that, of course, integrated planning is needed and ongoing. Some aspects of management were happening, but although it was mentioned, like in Ethiopia, podoconiosis, LF, and leprosy was integrated for management. But it is still at the level of the good practice, and that we are not seeing so much happening yet at a larger level. On the other hand, we did not hear about, in the below I listed 8 areas that we did not hear from the countries, which are surgery, wound and lymphedema management, stigma, referral and support systems, supply chain, M&E, nutrition, and One Health. So these were the progress and the gaps that we had. So this means that, but some of the areas we did hear from the other sessions, but mostly were research. And so this means that this is not yet happening at operational or the country level. Challenges that were shared were lack of human resources at country level, access to care, for example, how we can ensure completeness of treatment for leprosy, access to and cost of medications, limited and unstable resources, as well as geographically and politically challenged areas. The needs shared were improving social mobilization, ensuring access to medication and care, innovations, and innovation may happen from those young people, having more young people involved in our strategies. Context-specific interventions and government ownerships are needed. And also the integration is based on the simultaneous use of several methods and areas. And so the question is how we can best measure this impact. So the clearer methodologies are needed, as well as a clear guideline on integration for mainstreaming, which also has been mentioned in the roadmap. So these are some of the takeaway messages from our session. Thank you.
Thank you, Rhea. Again, this is very comprehensive and has set some challenges for us. Can I now call on Dr. Esther Freeman? Oh, you're going to do it, okay.
So I'll do it for Esther, who's just sitting on a delayed plane, not going to make her connection back to the States. But anyway, this is the third session that she chaired on training tools, where there was a comprehensive review of training tools. We were encouraged to critically learn from each other and perhaps make sure that we are reviewing all the materials that are existing. In Ethiopia, we heard about on-the-job learning for integrated skin NTD screening and care, which highlighted the need to meet people where they are and demonstrated the need for task shifting through a randomized controlled trial. Here they emphasized the interaction between different cadres of healthcare workers and dermatologists, showing how effective this could be, with dermatologists playing key oversight and training roles of the frontline healthcare workers, and emphasized the importance of additional ongoing training. They also emphasized the importance of soft skills, of communication and logistics, in addition to skin-specific knowledge. We had several examples of different mHealth apps for training from Ghana, Kenya, and Côte d'Ivoire, and the importance of offline connectivity seemed to be highlighted and emphasized, as well as availability in multiple local languages, not just main national languages. And the role of the local endemic country and local leaders in augmenting the AI was key to make it locally relevant. So positive outcomes of some of these trainings included mixed methods results, such as a healthcare worker who was noted to say, I used to write dermatoses, and now I write a diagnosis. Updated WHO skin NTD tools include the mobile app and open WHO courses, and Jose Postigo shared all of those with us. And we were encouraged to build on existing resources, and very grateful to hear from Info NTD, their fantastic resource, and how Neglected Tropical Diseases Cross-Cutting Group, Skin Cross-Cutting Group, have made efforts to summarize and review existing tools. So overall, the themes included integrated training, emphasis of e-tools and AI as support for on-the-ground and in-person training.
Thank you very much, Claire, on behalf of Esther. Esther's had to rush home for a very important birthday party, so she's excused. So thank you for that. Now, our next chair who's going to present is Ghislaine Sopo.
OK, thank you, Chairman. Voilà, j'ai modéré cette session 4.
I led session 4 on integrated surveillance and mapping, and I was assisted by 2 rapporteurs. And we had 2 main points from this session. The first was the place of mapping and surveillance for the control of skin NTDs. And the second point was the outcome of integrated surveillance activity implementation in the work against skin NTDs. Next slide there. One back, please. When it comes to the place of mapping and surveillance for skin NTDs, we must remember above all that the understanding of the prevalence and distribution is essential, in particular where there is low incidence and focal distribution in endemic countries. So it's very important that we can implement mapping, but also surveillance, because these are powerful tools for decision making. We must also work in a combined manner and put it together with operational research. And in addition, we saw that good training of healthcare workers, diagnosis confirmation, and the use of integrated data collection tools are necessary for quality data. Next slide. When it comes to the outcome of the implementation of integrated surveillance activities, there are 2 main points. When it comes to yours is currently integrated into only 12 out of 35 countries' surveillance system, so it's not sufficiently integrated. So it's recommended, and countries are urged to strengthen their surveillance for yours and to integrate yours into their NTD master plans. And it's also suggested that they assess the current status of the disease in the various countries. Next slide. The outcome of the integrated surveillance activities. It was also shown that there is effectiveness of this strategy, but also that the integrated activities allowed us to highlight the burden of diseases such as scabies, tongiasis, podoconiosis, and superficial mycosis. So it's recommended that countries should consider these diseases in their programs and assess their burden and co-endemicity, as they will be able to benefit of the same cross-cutting interventions, such as WASH and other health promotion interventions, and working on reduction of stigma and discrimination. These are very important also for our work. So that's the essential of what we should recall from session 4. Thank you very much.
Thank you, Professor Sopo. Very important to hear this repeated emphasis on the importance of integrating these activities. So thank you very much for doing that. Right, can we now turn to Christian Johnson?
Thank you. Yes. I will read feedback on the session 5 diapo.
On va aller à la session. We're going to go to session 5. So we're looking at the importance of the problems and the challenges. We saw that skin NTD disease
Stigma, mental health issues, restriction in social participation and exclusion. And we also say that millions of people experience lifelong consequences of skin NTDs. However, they frequently receive very little attention in NTD programs. And also, we say that the magnitude and the distribution of NTD-related disability not known, and management of complication is fragmented in health services and medical and social economical services handled by separate ministries, and these involve of difficulties in the management of these complications. We also feedback on specific presentation on podogoniosis, leprosy, tongiasis, as well as lymphatic filariasis with regard to stigma, mental health issues, disabilities, and socio-economical consequences. And all these issues have been presented and discussed. And it came out of these presentations that holistic management is needed, and the participation of people affected is also very important to achieve good results. Mrs. Toma also is presented, and we found that it is a chronic disabling disease, and we need research as well as adequate intervention to reduce the suffering of patients. Yeah. What needs to be done? We say that community-based rehabilitation or disability-inclusive development could be a way to address the problem where people live. And close collaboration and co-creation with patient organizations may also generate program benefits and improve outcomes. Mental health and skin NTDs is an important issue and need to be assessed, and adequate intervention needs to be designed and implemented. Also, operational research to generate data and evidence for interventions is also discussed. Diapo. We discuss key points during our discussion. It is first, impact of disease on patients, impact on holistic approaches, but also people-centered approaches, and importance of involving patients' organization, need to consider human rights and importance of involving other UN agencies working on human rights, need to update recommendation on new guidelines, particularly for lymphatic filariasis, need to improve data quality and psychosocial assistance on people affected by skin NTDs. Thank you very much.
Thank you very much, Dr. Johnson. I'm very pleased you started by reminding us that when we eliminate these diseases, there will still be a legacy of disability that needs to be dealt with, and we will have to give thought to that. So thank you. Our next presentation is from Lydia Mossi.
Thank you, Mr. Chair. I will present on behalf of Dr. Mossi. Unfortunately, she could not be with us today. In Australia, evidence has shown that Mycobacterium ulcerans can be transmitted to humans by mosquitoes. The genome sequence of M. ulcerans from humans, opossum droppings, and mosquitoes were identical. Possum excreta could be a very powerful public health tool in predicting where human cases could appear. Evidence shows that Buruli ulcer is a zoonosis. Genomics could be used to understand the historical movements of M. ulcerans and assist in predicting the geographical origins of Buruli ulcer cases. Oral-based BCG vaccination has shown protection against M. ulcerans and could be used to vaccinate the ringtail possums to reduce Buruli ulcer. Knowledge of evolutionary ecology can play an important role in understanding and controlling mycobacterial skin diseases. A controlled human injection model of Buruli ulcer was developed and established to study multiple aspects of the disease. Shifting a bit of continents, low-grade transmission occurs in leprosy and lymphatic filariasis for decades after elimination in Sri Lanka. Elimination as a public health problem does not warrant the natural elimination of transmission of the disease. M. ulcerans has been found abundant in the first larval generation of Aedes albopictus, and overall, the data shown suggests that mosquitoes may play a role in the spread of Buruli ulcer. Thank you very much.
Thank you very much. And that was a particularly fascinating session that we listened to, but it will also be good to hear about transmission problems with other diseases. I can think of a few that we can discuss at subsequent meetings, so thank you. Can I now invite Tim Stineer to present on behalf of his session?
So Tim Stineer is also, I think, currently in transit, so he's invited me as his PhD student to come and give a summary of this session. So I think Tim is actually zooming in on this session, so he can probably, I guess, maybe listen in and put some messages in the Zoom chat if he needs to. But I listened to Kingsley's advice earlier, and I just put very few words on the slide and just one big picture to represent the session that Tim chaired. What I did is I actually looked at the emerging themes, so thank you to the reporter who provided these notes for me. I actually did all of the note-taking myself, so if there's anything that's been misrepresented, I've got no one else but myself to blame. So I came up with 5 key themes. So these are my messages from this particular session that Tim chaired. The first theme was about integration, which we've heard so much about today. So diagnostics remain a very key aspect of the NTD's roadmap because early detection and treatment really does remain the key to controlling many NTDs. Capacity building will further empower the harmonisation and the integration of in-country laboratory networks and ensure the quality assurance standards are met and established. The second theme I found in looking at my notes was about access. So diagnostics performed in centralised laboratories that are very far away removed from where people need them the most are relatively important, but alone they're inadequate. So we need to enable diagnostics to be made available to people in their homes and in their community. They need to be made available in a timely fashion in order to facilitate targeted treatment and to direct public health responses. The third theme that I came across looking at my notes was quality. So we need to validate and certify the quality of the diagnostic tools that are being used. And it's a wonderful achievement to see that local networks, such as BU LabNet, are becoming empowered to validate the diagnostic tools and to identify their own areas of improvement. The fourth key theme that I came across was innovation, which was very exciting for me as a researcher. Valuable innovative research has enabled us to test mobile and point-of-care diagnostics, particularly for skin mycobacterioses, and there were some great sessions on that topic. So projects have studied mobile PCR technologies for the diagnosis of leprosy and Buruli ulcer, which have shown promising results. Nanotechnology-enabled lateral flow assays were tested to diagnose Buruli ulcer, and they were very innovative, and they targeted the mycolactone, which is the key virulence factor, but our colleagues nicely illustrated the many challenges to research and diagnostic development. And we heard the efforts of some of our collaborators to enable yours diagnostic capacity, including the establishment of in-country reference laboratories and the evaluation of technologies with frontline utility. We also learnt that grains produced from patients with mycetoma contain these wonderful hidden molecular diagnostic treasures, but they can only really be revealed if you beat them aggressively, which I thought was very interesting. And we also learnt that you can squeeze an entire laboratory into a briefcase, bringing the lab to the patient. So I did have one comment on implementation as well, because the session stimulated a very interesting discussion at the end about the role of maintaining a clinical acumen to complement our diagnostic repertoire and algorithms. So for example, some of our colleagues showed a positive correlation between the clinical suspicion of Buruli ulcer and the subsequent PCR confirmation. So to me, this highlighted that no one knows neglected tropical diseases better than those who live and those who work most closely with people who are affected by these diseases in these communities. So there are many opportunities for us to learn from one another to ensure that we translate the diagnostic research that's being produced into a meaningful practical application and ensure that the appropriate diagnostic tests are used in a compatible clinical and epidemiological context. So that was my takeaway message. Thank you.
Stephen, thank you very much. I think perhaps it's another area where there's the real opportunity for integration beyond the NTDs, because all of us are aware of our colleagues in other areas of pathology have exactly the same problems and challenges. So you could make common cause. Right, can I now hand over to Michelle Murdoch?
Thank you. These are the take-home messages from session 8, which was yesterday afternoon. I'd like to thank my two rapporteurs, Dr. Augustine Ibeja and Dr. Victoria Cox. We were privileged to have a very comprehensive overview of current treatments by our keynote presenter, Professor Richard Phillips. And the take-home message is that without any new, effective and safe drugs, the eradication, elimination and control of skin NTDs within the 2030 roadmap remains vulnerable. Next, we were privileged to hear about a recent WHO global survey on implantation mycoses, and that revealed the variability in diagnostic methods and treatments used across many countries. But intriguingly, it does also, due to the tool that was used, it paves the way for a potential new global case report registry to address the enormous gap in epidemiological data for deep mycoses. We also heard about a very extensive patient database on cutaneous leishmaniasis in Pakistan, and it revealed higher rates of treatment failure in certain clinical subgroups of patients, which was very interesting, such as very young children, those who had facial lesions, and those with a very high parasite load. And moving on to wounds, we had a very dramatic presentation about the benefits of strong community engagement, which proved successful in actually transforming primary healthcare infrastructure for integrated wound care in Côte d'Ivoire. And staying on the subject of wounds, we considered the potential of a standardized wound care package that has been already used widely by Médecins Sans Frontières, but it might be used wider for low and middle income countries. Moving on to tungiasis, we had the very effective treatment of dimethicone oil revealed to us, but we noted that it is not available in all endemic areas, and this is something that is a need. Staying with tungiasis, there's been a report of secondary resistant bacterial infections in tungiasis patients, and this is of concern and generated some discussion. And finally, we had an update from the beta-lactam containing regimen for shortening Buruli ulcer therapy, and we look forward very much to hear some updates of this in the coming months and years. Thank you very much.
Thank you very much, Michelle. Imke, can I ask you to present?
Kingsley, there's a photo, and it's quite big. And thank you, Daniel, for sharing. And the rapporteurs, Rafael Ndri and Laura Dean, and the session we had just this morning, so I think actually it's still fresh in your memory. Nevertheless, the themes emerging was that implementation research is really needed. And we heard it already in the other sessions. The implementation word keeps coming back. Any innovation, we would need to know how to implement that. So we really need that science to be included to actually, in the end, make a change for our patients. The next theme emerging was to co-develop intervention with community members and with people affected. We heard some examples in the session. And we need system approaches to address the complex problems, and that in skin NTDs is essential. We also heard about health economy and how health economy is important in evaluating of different interventions and also in the impact of these interventions. Not just the costs of the intervention, but actually try to find out how much it will difference the economical differences of the impact of the intervention you are implementing. So toolkits and training materials are needed to support scale-up of integrated interventions, and that should not only be topics like treatment or but also include mental health and stigma, as is discussed also in other sessions. And an equal priority to non-MDA amenable diseases. And the final theme we thought emerged from our session was cross-disciplinarity, which actually is why we are all here together.
Thank you very much. I'm very glad there was an item in your session on economics, because as I said at the beginning, that's the sort of ammunition we need to reinforce our case. I'm due to give a summary. Could you put my slide up? While we're waiting for that, Kingsley said I was going to give a few words of wisdom at this stage. I have to tell you, at this stage on a Friday afternoon, I've run out of wisdom, even if I had any to start with. So what I'm going to do is just put some ideas down. And there were just three I was going to put. One thing that I reflected on is that it's become critical as this initiative in skinny NTDs rolls out, that we look at ways in which we can measure the ways in which what we're doing has been effective. And there are particular challenges within this. One, for instance, is training. How do we know that that's worked, that the people we've trained can now do the jobs we've trained them to do? And another one is particularly in the reduction of stigma, which is a real challenge, but it's one of our biggest problems. Now we've got that picture. Like Kingsley, I've also shown you a disease that no one's talked about today or during the week, although there has been a poster on Wednesday. This is one of the dreaded consequences of chromoblastomycosis. It's a squamous carcinoma, which comes sometimes in the area as the disease burns out. The other 2 points that I would like to make is we really need to give thought on how to keep the momentum going. This has been a fantastic meeting. We've learned a lot. We've renewed old friendships. We've made new friends. How do we keep it going? And I know over the coming months, our friends in the NTD department will give this great thought. But 2 thoughts that I had about it is, it's very important that we find a way of sharing the materials that we develop as they come forward. And just to embarrass a bit, but just to use an example, Laura Dean presented this morning on the manual that they've developed, and that's available online, isn't it, Laura? So if you Google it and look at it, and that's the sort of thing that we'll need to read and have access to. The second thing that sort of crossed my mind is that maybe we should give thought to having some way of communicating with each other. I'm not suggesting we all send massive emails, but maybe we should have a notice board, or maybe a brief summary sheet, news sheet that could be set up. And I've talked with some of my dermatological colleagues, and they are thinking about it, but would be very happy to help in that initiative. because it brings me back to the last point, which is that we're well aware that the NTDs, fully supported by WHO, rests on a very small number of people in this headquarters who work very hard, and they've done a sterling job. And again, I'd like to thank them, to all the staff. I'd also like to signal out Stephanie, because she's been sterling, and also Priya. The two of them have kept us in order. You have both kept us in order, and we thank you very much for your patience and good nature, because we've sorely tested it, so thank you. I'm going to hand over to Kingsley, perhaps, to close, but maybe we should just stand up, because we've been sitting down a long time. I don't suggest we take exercise, but we do have someone we have to wish happy birthday to, because Hugh, I don't know where Hugh is, but I have the name here, is celebrating a birthday. Hugh, there we are. Yeah. So, Hugh, we're not going to embarrass you by singing happy birthday to you, because we have such terrible voices, but we'd just like to publicly wish you happy birthday. So, everyone together, happy birthday, Hugh. Thank you very much. And I will now hand over to Kingsley.
All right. Before I say the last few words, I will ask Daniel to give some concluding remarks. Thank you, Daniel.
Thank you, Kingsley. So, thank you also, Rod. Really wonderful job for summarizing the 5-day sessions this morning before our Director General. I think we all agree it fully represents the essence of our 5 days meeting, and not only the essence, the call of this meeting, I think. So I don't want to make a long discourse. Everything has been summarized this afternoon very well, so there is no need to go back. But there is this buzzword coming again and again: integration, cross-cutting, collaboration, etc. All mean working together. So this also implies not only for countries, not only for partners, but also for WHO. So we take this message also back home. We all really need to work together across the departments, across the various sectors, across various programs. So especially for integrated skin and NTD, this is the only way forward. So in integration, it does not mean that looking for competing for resources, but it is contributing. It's not also, again, it does not mean to integrate everything. We keep the uniqueness and the specificity of each diseases. At the same time, we build on areas that we can do together. So that is, I think, the most important thing on message also when we talk of integration. But finally, I would like to thank, really to thank all, on behalf of the NTD department and the WHO, I would like to thank all the chairs who during, of these 5-day sessions, all the moderators. Really, we appreciate your support. I don't know why Kingsley likes, these breakless meetings. There was no coffee, tea break, but there was coffee. He has offered all the coffee and the snacks, but not the breaks to enjoy them. So hopefully we will improve next time. Then I also would like to thank the interpreters. Really, it's, providing interpretation, simultaneous interpretation services for 5 days. Thank you so much. It was a wonderful job. All the speakers and the presenters and those who have submitted their abstract and their work, but they were not able or given the chance to present here because of the limitation of time. We really appreciate your interest and appreciate also your efforts to present. I don't know if I have forgotten, but finally, I would like to thank my team, which is led by Kingsley, and the motor behind, Stefani, and also Priya and Jose Postigo. I don't see him. Where is he? Where are you hiding? Yeah, okay, over there also. Yes, so this is, the people who have been behind trying to get all these people. So at the early days when we were discussing, we wanted to limit it to few people. So, but Kingsley also pushed us to open it as much as possible. We were concerned about the logistics. However, it showed that we have a very able team. I would like all of you to thank and by applauding the team. So finally, I would like also the other teams who provided strong support, the capacity, especially the site team, the strategic analytics and information team, which is led by Albis, Samantha, Camila, all of you. Thank you so much for providing strong support. And also our department, the NTD department, the director for his moral support and also following up. He was the one who invited the director general, and as you have seen, the director general has given us his word before all these people. So we'll see it is a big boost for all of us for the NTD program. With this, I wish you all, and I thank you all, and I wish you all a safe trip back to home. Thank you. Over to you, Kingsley.
All right. So just a few announcements before we close. One, you will receive from Stephanie later today an email, a link to all the photos that were taken on Monday and Tuesday. Please download them before, because they are on a WeTransfer, so they will expire in 5 days' time. So as soon as you get the link, please download them. Second is that next week we will compile all the PowerPoints, put also in a link that will be shared with everyone. So look out for that email. And then later on, once we have, we got some abstracts a bit late, so they are still with translation services. Once we have all, we'll compile the abstract booklet and put them online. We will also send you the link for your own reference. You see the room? It's so beautiful. Yeah, high tech, very high tech. They should be part of the memories when you go. But to make this work, there are people behind the scenes. There are our conference service people, our IT. They are all working 24/7 with us, all here to deal with any problems that we faced. You may not have seen them visibly, but they were there. Please let us clap for them, for their support. Daniel has already thanked the interpreters, but I would like us to thank them again. Although we didn't have coffee breaks, we still had coffee. and there is one for us to go. So again, let us thank the conference, the food service people, for also being on time, giving us varieties. Yeah, we didn't have time to eat all, but we thank them for helping us also. Then finally, the end of one meeting is the beginning of the next. We said the first WHO meeting on skin NTDs. The next one will be held in 2025, in March, almost the same time. I prefer to keep the calendar in the same order so that mentally you don't forget. We need 2 years gap in order for us to accumulate more work to present. So as you leave here, keep working and keep in mind that in 2 years' time, you will like to present your work. But in addition to that, to keep the momentum, I encourage the regions to also see how to take this forward, especially in 2024, going until we meet in 2025. So a bit of work, and also for the countries and for partners. As Professor Rod Hay said, let's keep the momentum until we meet again. It's been a fantastic meeting, and I hope that we have all learned from each other. Sometimes when you go to one disease-specific meetings, you only learn what you already know. And in those days when we're only having Borrelia ulcer meeting, I tell presenters, don't give the background, because everybody there is supposed to know Borrelia ulcer. So there's no need to say Borrelia ulcer is caused by this, stop that. And then, but now you have to give, because there's a guy people from Tungiasis, people from mycetoma, scabies, etc., etc. But it's part of education. You have to learn other things, even if you are a specialist in one thing. So this kind of meeting provides that opportunity for that. Colleagues and friends, in a way, what time is it now? Yeah, I said we will finish in 90 minutes. We are on time. There's some coffee outside, some shopping to do, I know. Some people wanted to buy games for their children. They can go to Manor in town. The same Manor, the first floor, has a lot of variety of chocolates. I encourage you to take some souvenir Swiss chocolates back home. Stephanie, if you have something to say, please, I now hand over to you before we leave.